It's become the desperately sad, recurring story of coronavirus. More black, Asian and ethnic minority healthcare workers are dying than their white counterparts. If anyone can help explain why, it's the colleagues of those who've lost their lives. In the biggest survey of its kind, we asked BAME doctors and nurses about their experiences on the COVID front line. The results are stark. They don't really care about us, says one. Another will be leaving the NHS as a result.
Things are not equal yet. Things are not equal.
Anu Agbula is a deputy sister at a mental health hospital.
If you did feel sick at the beginning of COVID-19, you were less likely to say that I don't feel well, or you're more likely to say that it's just a cough.
Why?
I think it's probably just the idea that you'd be judged. So if you was the first person to come out with a symptom, you would feel like, oh, they're going to think it's, the black woman that's brought this virus into the hospital.
Anu isn't alone. More than 2,000 BAME healthcare workers contributed to our survey, leaving more than 4,000 similar comments. What came up again and again and again was a feeling of being discriminated against, the idea that they were being disproportionately put on COVID wards. And some spoke of being told to keep quiet and carry on, and others said that they felt like they were working at the coalface, while in management it resembled snowy white peaks.
Some of my colleagues might find it hard to actually speak up.
COVID-19 killed Via Salinasol's best friend, a fellow Filipino nurse. She believes the sense of obligation she has is culturally inherent.
We don't find it in our hearts to say no, to stop going into a ward because we can't cope, because we're having issues with PPE. It's quite a difficult situation to get yourselves into, especially if your job is not just a job, but it's a duty.
Do you think your white colleagues feel the same?
I think they are more confident.
It's clear the overriding sentiment from the survey is that ethnic minority healthcare workers fear for their jobs if they make complaints. Since around 20% of the NHS workforce is made up of these groups, and our evidence suggests they're being put in higher risk positions, many feel change is long overdue.
What we must do immediately is recognise being a BAME doctor puts you at risk.
Dr Chand Nagpal is the chair of the British Medical Association.
This is a real concern, and it's about a culture in the NHS that has existed for a while, and it needed to be addressed. And the COVID pandemic, when you consider all the challenges of providing care within that pandemic, about redeployment, shortages of PPE, have in many ways brought to the fore these problems.
The government is also looking into why COVID-19 is affecting minority communities more. We put our findings on discrimination in the NHS to Matt Hancock.
It's something that I'm worried about and I'm determined to stamp out, and especially in this crisis. The value that we have for our healthcare workers has never been higher, and we need to reflect that in respect for, support for, and valuing of every single person.
Unless that happens, the daily emotional impact of watching colleagues who look like them die will not stop.
I can't help but worry. If I get it, will I end up like them?